kind of jump right in, if that's all right with you.
Great. A pleasure to be here talking with you.
Awesome. So my first question is both simple and not simple, but it's why do you do what you do? So what interests you about mental health or psychology, or who or what inspired you to get into this field?
Well, first, my work is very gratifying. We have what we call a secretary's test. That is, people look one way when they're sitting in the waiting room. My secretary notices if they look down or if it's a couple and they seem tense. She wants to see when they come out of their session with me that they look significantly more upbeat. So it's so gratifying for me, as well as for my secretary, to see the changes that can happen within a therapy session.
Oh, that's okay. I really like that you actually have kind of this assignment for your secretary to look at them before and kind of look at them after. That's fantastic. I've never heard that before.
Yes, I have a great secretary. And also, when people go from feeling down or worried to feeling relief, it's very visible on their face. It's audible in their tone of voice and how friendly they are with the secretary.
Yep, absolutely. So you wrote an entire book on treatment of mental health disorders without using prescriptions. Was this your first major writing undertaking? I know that you have written blog posts before, and kind of what was that process like?
Well, this was my fifth book, Prescriptions Without Pills. It's actually primarily a self-help book, although therapists also often benefit from learning the techniques I suggest.
And did you enjoy the writing process? Is that something that you really like about your job, or do you prefer less of the writing and more of kind of the one-on-one?
I think the older I get, the more I want to share what I've learned in 40 plus years of practice. I very much enjoy virtually every therapy session, and at the same time, it's meaningful to write books. Now, I say it's meaningful because I can't really tell you what I feel when I'm writing. I just sit down and start writing, and at some point I stop, and in between I don't really know what goes on. It's just something that happens. Like when you drive a car, you're not aware of everything you're doing. Mm-hmm. You just get in the flow.
Right. Yeah. Oh, there have been times, this is probably bad, but there have been times where I've left work and gotten halfway home and been like, wait, how did I get here?
Exactly.
Well, that's neat, because I've heard from different writers that, some of them have a really strict process, or some of them have to set aside time for writing, but it sounds like you just kind of get lost in the writing, which I think is a good sign.
Exactly.
Do you think that you'll write?
There's not much for me, now that I think about it. You know how you feel when there's a good storyteller and just listening to the story as it comes out? Yeah. I think I'm just caught up in the storyline of whatever I'm writing, fiction or nonfiction.
Yeah, that's fantastic. Yeah, it's if you can get caught up in the writing part of it, I think that's even better. Hopefully that makes it more compelling. Yeah.
Yes.
So you also let me link everyone to this TED Talk as well. So I just put a link to your website in the chat box as well, but let me link everyone specifically to your TED Talk on treating depression without medication, and I had the link up.
Yes.
Here we go.
On YouTube?
Yes, yeah. Okay, so this TED Talk right here, let me pause before it starts playing on my on my computer screen. This YouTube right here, this YouTube video is a TEDx presentation on lifting depression with these 3 prescriptions without pills that you gave. When was this given?
Oh, I think it's almost 3 years. It's 2 or 3 years. I'm not sure which.
Yeah. And you compared depression to the common cold, which I I love that comparison, that it's like something that anyone could catch, something that could happen, you know, at any point in time, and it's not just always this mystic thing that's out there. It's actually something that's becoming more and more understood. So going along that line of thinking, what are some of the signs of depression that you would recommend people watch for?
The signs of any depression are somewhat similar. The intensity varies. So there's depression with a small d, kind of like the common cold. And then there's depression you could think of with the big D, and that's more like getting pneumonia. It can really knock someone out. So what we're talking about today is mostly small d depression, the kind of depression that everybody feels from time to time. So what are the signs? Usually less energy, and a feeling of a cloud being over you, or living in semi-darkness rather than having the sunshine out. That's the feeling state. Thoughts change when you're depressed. When you're depressed, you'll have more negative thoughts. Negative thoughts about yourself, negative thoughts about other people. You'll be more irritable, and negative thoughts about your future. That's called the negative cognitive triad. Just plain old negativity.
So you said that's called the negative triad?
The negative cognitive, like
negative cognitive
triad.
Gotcha. Interesting.
Yes.
Okay.
Yes.
And that's kind of the small d depression, as you described it.
It's both of them. The frequency and intensity differs with the big D.
Okay. I understand. Yes. All right. So
activities that you would normally enjoy when you're depressed, take exercise, for instance. When you're depressed, you just don't feel like doing it. Maybe once you get going, you feel fine. There's just a low energy, low motivation, dark feeling.
Yeah, absolutely. So how does depression impact those around you? Your friendships, coworkers, relationships, even kind of kids and family? Can you describe that a little bit?
Well, that's a good question, because some people are better at play acting than others, pretending to be upbeat, or sometimes when you're around other people, you get feeling more upbeat. At the same time, remember, in the negative cognitive triad was negative feelings towards others. So if you have a friend over and they're just kind of sitting on the couch, normally you might look at them and say, geez, I'm so fond of her or him. And when you're depressed, you might look over and say, what a nuisance. She's so lazy. Or he's so lethargic. What a bummer to have him around. You just think negatively, react negatively. That, of course, does not have a great impact a very positive impact on your relationship. If you get irritable or frustrated, you're starting down a negative path.
Yeah, definitely could see that impacting a lot of relationships, even at work. But especially, I feel like, especially the people around you, probably. And again, I like what you said about some people are better at play acting than others, because so many times we've talked about, you know, putting on this mask and going about your day, and people saying, well, you know,
put on a happy face.
Yes. Or, well, you don't look depressed. Like, okay, well, tell me what depression looks like, because hi, it's me.
I can tell you one thing that depression does look like, by looking at the opposite. When you feel good, you smile more, and your face is more expressive. If you're feeling down, there's just less mobility to your face and fewer smiles.
Yeah.
Even your eyes don't have that same sparkle that they might have when you're happy.
Yeah, I've never thought about your face being more expressive. I think that's a really good way to kind of point out the differences, because anybody can smile, right? But sometimes that smile, like, it doesn't light up your eyes. There's no, you know, no expression on the rest of your face. So I think that's really good.
You're exactly right. When a smile comes from internally feeling enthusiastic, you radiate positive energy. When the smile is just plastered on, actually your eyes don't quite match up with your smiling mouth, and that positive energy and positive enthusiasm just doesn't come through.
Yeah, absolutely. Theatrical gamer said, worst thing someone can say is you don't look depressed. Yeah, absolutely. I mean, that's it's like, oh, okay, so you're telling me that my feelings aren't valid. That's good. That's helpful.
Or in a way, that's a compliment. Oh, you're telling me I don't look depressed? I'm so relieved. I don't want to walk around with a flag that says, I'm depressed, I'm depressed.
Right.
Most people want to look normal, even if they're feeling a bit down.
Yeah, absolutely. So whenever you're talking about treating depression without medication, so why would someone choose to avoid medications when treating depression? What are some of the reasons for that?
Okay, so the medications are advertised as being non-addictive. It's only partly true. Addiction is defined as having a craving for something. Like, I can't wait to get my next fix. Well, people don't wake up in the morning thinking, oh, I can't wait to take my next Prozac pill. It doesn't have an immediate upper feeling like that. At the same time, when you take those medications, they make you drug dependent. That is, if you stop taking the medicine after you've been taking it for a period of time, just stopping triggers what's called a rebound depression. Your body has forgotten how to make normal, happy chemicals. So you get down because you don't have your pills. Not that you needed the pills to begin with, or that your depression would still be there if you hadn't taken pills. It's just that the pills have made you drug dependent. Scary?
Yeah.
Yeah.
Yeah, that's, I
and
mean,
there are,
well, I was just going to say it makes perfect sense if your body is used to getting these outside boosts in your mood and in those chemicals in your brain. You know, it can lessen what it makes to whatever level it feels comfortable with.
Exactly. The factory shuts down.
Yeah, yeah. And do people usually pull back out of that without re-medicating?
If they can wait it through. It depends usually on how long people have been on them. So I knew someone who'd been on antidepressants for 15 or 20 years. She actually, this is an extreme case, was 30 days in the hospital before she was normal enough and not feeling suicidal to be out and on her own. That's an extreme. People vary enormously in how quickly their body bounces back. The other thing about antidepressants that many people complain of, though, is that although they're wonderful for getting rid of the extreme low feeling, they also numb people out to a certain extent. So they're not feeling joy either. One woman told me, I took them for 10 years, and I feel like I had 10 years of my life robbed away from me.
Oh, wow.
I wasn't really living. Now, that's not everybody. Some people take antidepressants. They feel normal, they feel good, and, you know, more power to them.
So the other kind of alternative to taking medications brings in some talk therapy, cognitive behavioral therapy kinds of things. So how effective is that for depression typically?
Well, the studies say that both CBT, cognitive behavioral therapy, and psychodynamic therapy, where you look at the back, what's gone on before that led you to feel the way you are today, that there's about the same level of effectiveness as medication. The technique I show in the TEDx talk and I write about in Prescriptions Without Pills, I think works much better. I have not had good researchers looking at them because it's something that I've developed as a clinician and just use. If I look at the impacts on people I work with, it's pretty dramatic. Usually within that session, you see a big change in how people feel.
Wow. Yeah, just with one session?
Yeah. Now, does it always last? They may have to do it another time. They have to implement what they discovered in the visualization. Usually, it does pop people out of that low energy, negative state.
Yeah. And do you find that a lot of people tend to implement everything that was talked about in that session, or do people have to kind of, is it more of like a practice makes perfect kind of thing, where maybe they get one thing right and have to come back and work on it more? And
well, what we discover in the exercise, should I give you a little example of how it works?
Yeah, absolutely.
Okay. So say I'm saying a man and he's really quite depressed. So I say to him, close your eyes, take a deep breath and relax, and then allow an image to come up of who or what you might be angry at. Not yourself.
Mm-hmm.
Notice who or maybe what comes up on the video screen. So what he sees is his boss. So the next question is, what's he doing and what is it that you want there? Mm-hmm. So the man says, well, his boss is frowning at him and his boss is berating him and he doesn't like it at all. What he wants is to be treated much more positive way. So then the follow-up question is, who looks bigger, you or your boss?
Yeah.
Now that question is really important because that question tells me whether we found the right incident. And also it tells me, is he really depressed? So if he says, well, I look much bigger than my boss, he's a jerk. Either the man's not depressed or we haven't yet found the right cause. That rarely happens. Most of the time, the man, let's give him a name, Bob. Bob will say, well, I look small and my boss looks big. Mm-hmm. Oh, how much of a difference is there, I'll ask. Well, I look like a little mouse on the floor and he looks like some kind of giant. That would be a sign of serious depression. A more minor depression might be, well, he looks about 10 inches taller than me. He's not really. I'm taller than him. But somehow I'm looking up at him. Actually, maybe he's bigger than that, twice my size. Mm-hmm. And all the time he's doing this, Bob's eyes are closed. He's looking at the imagery on his mental screen.
Right.
We all have a little screen in our heads.
Yeah.
Just have to close your eyes. Don't even have to plug it into the electric outlet. Okay, so now we've pinpointed, that's step one, what the problem is. Mm-hmm. That's interaction between the boss and Bob is what's triggering the depression. So now, you ready to start getting rid of the depression? Let's go for it.
All right.
I would say to him, take a deep breath, keeping your eyes closed. And as you're taking those deep breaths, feel yourself growing bigger and bigger. How much bigger are you now than your boss? And Bob might say, well, I'm at least about the same size. Good, I'd say. Okay, now take some more breaths until you're substantially bigger than he is. Mm-hmm. So once Bob is significantly bigger, that is, he did step two, pumping up, then we're ready for part three, which is problem solving. I call it the 3 Ps: pinpointing the problem, pumping up, and then problem solving. So at this point, I'd ask Bob, from this bigger size, looking down on your boss, what can you see that you weren't noticing before? So Bob looks down and he says, oh, my boss is actually kind of an insecure guy. He barks at everyone. It's not just me he barks at.
Mm-hmm.
But he's insecure and irritable. He's actually a very unpleasant person. So Bob might say, I think I've been taking personally what's just this guy's problem. Actually, Bob might say, when I look down from this height, I feel almost compassionate for him. This guy is pathetic.
Yeah.
So the problem solving, whoops, did you lose me there?
Nope, I can still hear you.
Okay,
can you hear me?
Good. Okay. Yes, and you can see me. Okay, good. So what's changed here? What's changed is Bob's way of seeing the other fellow. He's still not necessarily going to like the boss,
mm-hmm.
but does his boss make him depressed? No. So then in problem solving, you could add, so what can you do differently now that you're realizing that you're a much bigger person than he is? They're very lovely fellow people like you, and the boss is not just picking on you, he's that way to everybody. So then Bob thinks about it, and he might come up with, well, I'm just not going to take him so seriously. He might come up with, I think I'm going to talk with the other guys in the office. Maybe we'll start a little revolution. Maybe he'll say, that guy just is the way he is. And in fact, the whole office has a dark feeling to it. I'm going to start looking around for another job. Life's too short to have to deal with someone like that. Now, he hasn't solved the problem yet. He hasn't implemented it. But even just having a vision of what he could do often will help somebody just kind of eliminate that dark cloud.
Yeah. Well, and just even I like kind of saying, okay, well, these are the things that I can do, and here's some steps that I can take. Like, it feels really empowering.
Exactly.
Yeah.
Absolutely. And empowering, I'm so glad you used that word. Depression is a disorder of power. Remember how small Bob looked
mm-hmm.
when he was picturing himself in that first image? And by the end, he's empowered. He looks physically bigger, and he feels internally more powerful.
Yeah. Yeah. So do you feel like depression is always this disorder of power?
Yes. That's the bottom line. Now, people with a major depression and people who've been on medication for a long time, they tend to believe that it's all biochemical. They're right on one level. Just like our chemistry changes when we're happy, our chemistry changes when we're down.
Mm-hmm.
That doesn't mean it's necessary to treat it with chemicals.
Right. Well, and that's kind of the correlation and causation, which came first, the chemicals or are you feeling bad?
Exactly. You've got it. And most importantly, which is going to get you feeling better.
Yeah. So do you feel like you can treat depression caused by CPTSD or grief or loss or trauma without medications, or is this kind of a limitation only? Is there only a limitation when it's something like a chemical imbalance with postpartum depression?
Postpartum depression, I did my doctoral thesis on postpartum depression.
Oh, wow.
And what I found was there's virtually always a trigger. So this exercise actually works very well. If the mother closes her eyes, she's usually mad either at the baby because the baby cries so much every time I try to go to sleep,
mm-hmm.
or she's mad at her husband. He just doesn't help out.
Oh, yeah.
Or at whatever. So once she's pinpointed what the problem is, then we can find a solution. The baby who, quote, cries all the time, the baby may have a problem, or it may be that she just needs help for a week or two until the mother herself, until she's a little stronger. And then when the baby cries, she can pick him up and she'll be more soothing. Because when somebody's
mm-hmm.
depressed, the baby might even pick that up.
Yeah, that's a good point too.
Yeah. You asked me something earlier about other kinds of depression, like PTSD.
Mm-hmm.
PTSD is a somewhat different phenomenon.
Mm-hmm.
There can be some depression associated with it. Sometimes the depression is because people can't get rid of the other symptoms of PTSD, like startling or chronic negative thoughts.
Mm-hmm.
There are other techniques I'd begin to use before this technique, unless what may have been triggered by PTSD is being felt just as a depression.
Mm-hmm. So are there, aside from instances where there is an immediate limitation or where you kind of have to get some other things out of the way before you treat depression, is there ever a time where you would say, okay, it's time to take some meds while we work this out?
Yes, there are some circumstances where I'd recommend medication. One is if they're feeling suicidal, unless we can get a clear breakthrough from this exercise, I'd probably recommend they start medication. You don't want to mess around with suicide.
Yeah.
Second instance, and I've rarely had this, only 1 or 2 times over 40 years, when someone is doing the exercise, if they can't maintain that big size long enough to problem solve, they just keep shrinking back. My understanding then is that's probably because there's something going on biologically. Another thing to look at, another thing to look at is, are they sleep deprived? Everybody feels more and more down and low energy when they just haven't had enough sleep.
Mm-hmm.
So the cause, like you were saying, you have to look at cause and effect a little.
Yeah.
Sometimes the cause might be something physical like that, like not getting sleep. Another cause, I saw one case many years ago, and I will never forget I'll tell you the solution first.
Okay.
Bananas.
Oh,
Do you know
right.
what bananas are a solution to?
What's that?
Low potassium.
Mm-hmm. Yep.
I had suggested she at least get a blood workup, see if we can see if there's anything else going on medically in her body. Because when she tried to picture who she was mad at, nothing came up. Menopausal women also, when they try to picture who they're mad at, nothing comes up. So that would say there's something physiological going on.
Yeah.
Low potassium, menopause, something.
And having them get blood work done, that would really bring that up and show you, like, okay, well, this is what's going on, and this is what you need to do to kind of fix it.
Certainly a potassium deficiency, and it may be that there are other medical problems also that show up as depression.
Yeah. So you've outlined how a tendency to give up in response to not getting something that you want can kind of trigger depression. Can you describe...
Exactly.
Yeah. So can you describe conflict resolution or bump theory and how to reliably identify that bump?
Okay. This is going to be a little tricky to do while I'm holding the phone in one hand, but I'll give it a try. If listeners can put their hand out. Here we go. Okay. You're going down the road of life, and then, boop, you hit a bump. See on your wrist there, that bump? That stands for a problem, a dilemma, a conflict, a fight you had with somebody, something that's not working out, a decision, an issue of any kind in your life. And you know you've hit a bump because negative feelings come up. You don't feel too good about it. At that point, you then have, let me turn, I can see it better this way. See this map?
Yep.
4 roads down the fingers and 1 road up the thumb.
Yep.
Okay. Once you've hit the bump, you can pick one of those 4 roads or the thumb route. So the thumb route, we'll get to at the end. The first road is depression road. You give up on getting what you want in that situation. If you fold, giving up on what you want, fold road goes to depression. So if you don't want to be depressed, you could fight, get angry. That anger road has its own consequences. So maybe you don't want to fold, you don't want to fight. Maybe what you want to do is just freeze. What freezes is your brain. You're still walking and talking, but you've stopped thinking about what to do about the problem. If your brain freezes in terms of problem solving, that perpetuates anxiety. Oh no, what'll I do? What'll I do? What'll I do? There's a fourth route, the fourth finger. That's the pinky there. Flee route. It's too uncomfortable to fight or to fold and get depressed or to feel anxious all the time because your brain freezes. So instead you stop off at the bar. The drinking takes away those feelings. It just creates new problems. And most importantly, it doesn't solve the bump. Okay, along comes our fifth option, the thumb route. If you face squarely the problem and begin finding solutions, like when somebody's pumped themselves up, someone who's been depressed, and they can then see more data and come up with solutions, then they go up the thumb road and tootle along in the land of well-being until they hit the next bump.
The next bump, right.
Right. So people who seem to be happy most of the time, it's not necessarily that they don't have problems that they encounter. It's that when the problem does come up, they find solutions. Now, that's not totally true. Some people's lives have much more challenge to them, financial problems, difficult people in their family, alcoholism, whatever. On the whole, though, to the extent that when people see a problem or a dilemma, they look at it squarely and find a solution, think, what can I do about this? That keeps them in the realm of well-being.
I like it. So you've got, and this is on your website as well. I'm just going to post your website again. Because I remember seeing the hand on your website.
Yes.
Let's see here.
That's on the Prescriptions Without Pills website.
Yes.
I have a number of different websites for relationship skills. That one's Power of Two Marriage, although you don't have to be married to go there.
That's a good point too. So here's for everybody in chat, here's the website again, and if you click on that, you'll see kind of the person walking on their path and the bump and the finding the solutions and all of those as well.
Exactly.
So it's great.
And the routes that lead to the four main emotional distress signs: anger, depression, anxiety, and addictions or obsessive compulsive disorders.
And then I will also I'm also going to post the Power of Two marriage. And I'm really glad to hear you say, like, you don't have to be married to go to this, because I think that this is something that's really important, that if you're in a relationship and you want to work on it, like, you don't just have to give up even if you're not married. It's something that you can work on still.
And in fact, if you're not in a relationship, boy, that's the time to go to the power2marriage.com website, because you want to be sure you have the skills so that once you are in a relationship, you can handle it in a way that will be effective and keep the relationship positive and loving. Yeah. Maintaining an intimate relationship, a real partnership, that's a high skills activity.
That it is. It is. And so
sounds like you speak from experience.
Yeah. Well, I am married. Our eighth wedding anniversary is October 1st. So we've
congratulations.
We've got 4 kids and everything keeps us on our toes.
Yes. That is excellent.
Yeah. So
yes, we also had 4 children.
It's you know what? It's stressful. It's stressful, but very worth it.
A lot of bumps.
There's
a lot of challenges that come up. If you're thinking all the time and coming up with better systems for how to get food on the table, how to get everyone to do their chores, how to get them out of bed in the morning. The more you use the hand map and keep reminding yourself, I got mad about this yesterday and I'm mad about it again today. I think I need to switch to the thumb route and just sit back and think about what's going on here and how could I handle it in a more effective way.
And kind of identifying that bump is where you bring in the visualization piece of it.
You could, or sometimes it's pretty obvious.
Yeah, well, right.
You shouted at Johnny because he was late out the door for school yesterday, and now you find yourself tempted to shout again. I think you better look at what the morning routines are and figure out a way to help Johnny be ready to go on time or early.
Yeah. So in looking at depression as this disorder of power, like we've talked about, you recommended pump up practice and problem solving and creative solutions. So do those kinds of methods work for things larger than a single bump? Like you were just talking about, maybe something where you have these multiple bumps or a bump keeps occurring no matter what you do. Is this pump up practice kind of something that you would recommend for that situation as well?
It's complicated. Some problems do have multiple facets. So you solve one problem and then it turns out there's a second one. Let's take Bob, who was distressed by the critical tone from his boss. It may be that he feels good for a while and then he's feeling down again. He has to use it again and then use the visualization. What he pinpoints that time might be how chaotic the office feels.
Yeah.
So if he pumps up so he's bigger than the office, he may realize, in addition to our manager being hypercritical, he also doesn't clarify who's responsible for what. So we're all getting into each other's hair. Once he realizes that's the problem and he gets bigger, he can figure out something he might do to help himself and his colleagues maybe as well to clarify who's responsible for what.
Yeah, that is a good just general communications tip.
Yes.
I kind of feel like, a lot of problems, especially in the workplace, really come down to communication, and even sometimes in relationships, like it just comes back to communication over and over and over.
Right. Communication and problem solving go hand in hand because how do we solve problems? We talk with other people about what their concerns are. We verbalize our concerns, and together, hopefully, we come out with a win-win solution. That's mostly what I talk about in my other book and workbook, The Power of Two, and also the website poweroftwomarriage.com. One of the big themes there is how to resolve conflicts between people and what are the communication skills, how you say things, how you listen, that make it possible to come out with good solutions.
Yeah. So have you encountered any resistance to the idea that people can treat depression without medication, or is that becoming kind of widely accepted?
No, I groan because if people go and look at the TEDx talk, if you have the courage or the stomach to look at the comments, there's angry comment after angry comment. I think what happened is the drug companies or some maker of antidepressants was not comfortable with what I said because it's just negative comment after negative comment with no content to it.
Yeah.
She's funny looking, or this lady is stupid, or what baloney. Those kinds of meaningless comments that say I'm under attack, not that people are honestly thinking about the content of what I had to say.
Yeah.
And then the other group that gets angry is people marry their medication. That is, they love their medication in the sense that they think their medication is saving them. they do not like hearing that there may be downsides to taking medication. This is particularly people who have very serious depression. And they may be right that the medications for them are keeping them alive. The vast majority of depression is small d depression and would be handled much better with the 3 Ps. Pinpoint it, pump up, and problem solve.
Yeah. So I really hate to hear that you're getting negative comments on that video, because I thoroughly enjoyed it. And
good.
Now I'm going to have to go and leave a positive comment for you.
Oh, thank you. I love hearing that. I didn't want to ask you myself, and I'm so appreciative. If anybody watching and listening to this video and podcast would like to watch the video, and if they find it helpful, put a positive comment. Oh, I love you already.
Yeah, so I'm gonna post this again. There's the video that we're talking about, and Kuritsu has a question. So, how does one identify bipolar versus regular depression? And they said they feel like they often have very short depressive episodes, but they happen often and almost feel like a switch is being flipped. That's a good question.
Okay, so that's what's called cyclothymic, up, down, where there's very short depressive episodes and short highs. I don't have a simple answer.
So I
do have a simple answer.
Yeah.
If you're getting depressed and you close your eyes and you can't see what the trigger was, who you're mad at. Remember, that's the question. Who or what, not yourself, are you mad at? So if you can see triggers, and there are frequent depression-causing triggers in your life, that could be one hypothesis about what's going on. At the same time, with rapid variation in moods, it's important to check out, is there some kind of rapid cycling bipolar disorder there?
And what's the best way for them to find that out?
Well, other than experimenting with using the 3 Ps exercise, probably they need to see a psychiatrist.
Yeah.
Because that's what they are there to diagnose.
Yeah, absolutely. And we actually have, hang on, let me see if I can remember what it is. We actually have a command.
A command?
Yeah, we do. So we have a bot command. It's not that one. All right, I'll have to find it. But it's got links to where you can find the different mental health resources in your area. So Kuritsu, if you don't mind, I'll find that and send it to you. I just can't remember what it is right now. And they said thank you.
That was a question for someone.
Yeah.
People can Google mental health resources in my community, or therapists, low-cost therapists in my community.
Yeah.
Most communities have mental health services. Google is amazing for that.
Oh, Google is so amazing.
Yes.
And also I would say, like, I've done before where I found someone to go and see and didn't really click with them. So we've said it before, but don't be afraid to, if you're not happy with the services that you're getting, don't be afraid to find someone else. Like, not everyone is going to click with everybody, if that makes sense.
I 100% want to underline and highlight in bright yellow, neon yellow, what you just said. You are so right. Don't worry about you're going to hurt your therapist's feelings. It astounds me that people will stay with a bad therapy or a bad therapist match way too long. Your therapist is not your mother. You can leave at any point.
I love that. Your therapist is not your mother. You can leave at any point.
Right. Or your daddy.
Yes. I think that's fantastic. Yeah, it's one of those things that it's not, you wouldn't keep talking to someone about your primary care physician. You wouldn't keep that primary care physician if they were not listening to you and if they were not helping you. You would find someone else. Like, you need to treat mental health professionals kind of the same way.
A good test is, do you feel better after each session?
Yeah.
If you're not feeling, perkier and more hopeful after each session, try somewhere else.
Yeah. Have you ever had to fire a client and just said, "Hey, we're not a good fit"?
I have to think about that.
Yeah, we've.
Have I ever? No one's. Oh, I can think of one. It was a couple, and he was so insufferably self-centered. I felt like I couldn't deal with him.
Wow.
Fortunately, they got divorced.
Yeah.
She realized it. Oh, I know what happened. He stopped coming, and that's what usually happens. People who aren't going to benefit from therapy stop going. And then I was able to work just with the wife. This person was really quite abusive as well as self-centered. She needed to leave him.
Yeah.
I don't usually recommend people leave a marriage. I try to fix it. If we've tried to fix it and it's still on the abusive end, get out.
Yeah. Yep.
Begin looking at what holds you back and how could I get out?
Yeah. So, does treating depression without medication differ greatly from other disorders like anxiety or addiction or other issues like anger and relationships?
Yes. Each of those 4 roads has a different cure to bring people back to the bump and up the road, the thumb route of problem solving. So, for instance, if you're anxious, sometimes we're anxious and we're not quite sure why. The trick then is to sit down at your computer. I'm going to sneeze in a minute. Sorry about that.
It's fine. Bless you.
Excuse me. Okay.
Yeah.
So for anxiety, sit down at your computer, start typing all the thoughts that make you feel even more anxious. Number 1, da-da-da-da-da-da. Number 2, da-da-da-da. Number 3, no need to problem solve about them initially. Just initially make a list of all those thoughts. When someone comes into my office feeling anxious, I say, hold on, let me just get my pen and pad and I'll be your secretary. You close your eyes and let those thoughts just pour out. After we have the full list of all the anxiety-producing thoughts, then we circle back and take them one by one. With each concern, we take the thumb route. What could I do about that? Interestingly, often the best antidote to anxiety on any specific issue is information.
Yeah, all right.
So often the solution will be, well, where could I find out about that? So, for instance, if a teenager is very anxious that he's not going to be able to pass physics, oh, how can I find out about that? Oh, maybe I'll go talk with the teacher. Maybe I'll talk with other kids who've taken the course. I just need to gather more information.
Right.
And other times there are other cures. Take them one by one, thought by thought.
Okay. So
anger is different altogether. You want a quickie on what to do with anger?
Yes, absolutely, please.
A 2-step. First, when you're getting angry, exit. Either exit the conversation or exit the room. I suggest to people that they just stand up and start walking out and say, excuse me, I need a drink of water. If you act in anger, it's almost always causes more problems than it solves. Think of it this way. When you begin to feel anger, say to yourself, anger is a stop sign. What do you do with a stop sign?
You stop.
What do you do with a stop sign? You stop.
Yep.
You don't just keep blabbing and getting louder and louder.
Yeah.
And what else do you do once you've stopped?
Look around and then go.
Look around for what? You're exactly right. What are you looking for?
You're looking for other traffic.
Yes, to see what the problem is, or is it safe to move forward, or what's happening here. So you stop and you look and listen, and then you proceed. So with anger, what you do not do is pick up the stop sign and start clobbering people with it.
Yeah, that's true.
Hopefully you don't.
Hopefully,
do that.
right? Yeah.
If you do it, you've got an anger problem. Okay, so the first step is, if you feel yourself getting angry, give yourself a break. Just go somewhere else. Take a cold drink of water, read a magazine, do something else for a little bit, and then come back to talk in a quiet way, a productive way. So when you talk, this is part 2, you need to ask yourself, what is it that I want? It may be that the solution doesn't even require going back and talking with the person you were feeling angry at. Sometimes when you think, what is it that I want? You can come up with a solution by doing things differently yourself.
Yeah.
So, for instance, if you're feeling angry at your husband because after dinner he just gets up and falls asleep on the couch, so you're ending up doing all the dishes and putting the children to bed. What is it that I want? Oh, I want to feel less overloaded at night. I want to be able to enjoy putting the kids to bed. Oh, so what would be a better solution than getting mad at my husband because he's so sleepy after dinner? Oh, here's a different idea. Maybe I could put on music and tell the kids, dance time, and we all dance while we clear the table and put the dishes in the dishwasher.
Yeah, that's cute. I wonder how many dishes my kids would break if I told them to dance while putting them up.
As they toss them back and forth.
Yeah. No, but that's a really good example of just, like, instead of getting super angry at someone else, trying to do something about it in your environment and involving.
Exactly.
Yeah.
What do I want? And then what could I do differently to get what I want? It's not I want you to. It's I want to be less stressed at night.
Yeah. That's great.
Good.
So
that's where... Go ahead. Just each of those roads has a different solution. Anger road, anxiety road, depressive road.
All right.
Oh, and addictive road. That's often the hardest one because many people who have an addiction do it because it feels so good. Many people have the addiction as a way to escape, flee from a real problem. Studies have shown that people who are addiction prone tend to be the least effective as communicators and problem solvers. So they need to do something about that.
Yeah.
Learn skills for talking with people about whatever the conflict or problem is, and learn to address the problem face on and figure out a plan of action.
Yeah.
Yeah.
Yeah, I think that's definitely something that I could see.
Yes, and what makes it so hard when somebody has an addiction is if it's a genuine addiction, the pull of either the habit or the substance itself is such a current, an undertow that keeps pulling them out in addition to whatever the problem is that needs to be addressed. Difficult.
Yeah.
Get help.
Yeah. So is there an overall well-being strategy that you would recommend to anyone with or without an underlying disorder like depression?
Absolutely. The bump theory says when you have a problem, address it. And then the second piece would be make sure you have skills for addressing problems that occur between you and someone else. There are skills for how to raise the issue. There are skills for listening closely to what the other person says. And there's a specific recipe for how to move from conflict to different ideas about what to do to resolution. Learn the recipe.
And where would you point people to learn that?
If they go on prescriptionswithoutpills.com, I think there's a relationships section on the website. Check what's there. I don't remember truthfully what I've put there. The book itself also has a chapter on the basics of conflict resolution. If they Google conflict resolution Susan Heitler, I've written a number of Psychology Today blog posts. I think they can find it better by Googling my name and conflict resolution than by searching within the site. I've noticed that search there doesn't work so well.
I gotcha.
Yeah, but there's definitely a blog post there on that. On conflict resolution. Yeah. So I'm delighted if you want to get the book and workbook called The Power of Two.
Yep, absolutely. We have another community question. So is there a reliable way to treat depression without medication or supplements or seeing a therapist for those without access to mental health care or health insurance or those who can't afford it?
The best way I know is to choose a visualization we were talking about earlier.
Yeah.
And it's on my TEDx talk about lifting depression. Another thing that makes a big difference is exercise. Exercise doesn't get rid of the depression altogether. It lifts it temporarily so you feel re-energized.
Yeah.
And a lot of depression comes from a relationship you have with someone else. If you close your eyes and there's someone else in your life that looks bigger than you and you look smaller, get the skills for beginning to interact with that person in a different way.
Yeah. I love it. So if you could change one thing about mental health, the mental health field, or people's views of mental health professionals and educators, what would it be?
Oh, you ask tough questions. One thing I would change is I would tell them all, please learn how to work with couples, because most of people's upsets have to do with their interactions with others. I would say, second, include skills training in addition to insight in the therapy. Number three, I would tell them to read the book. My first big book was for professionals, From Conflict to Resolution. Basically, when you go to therapy, you're looking for help with resolving the conflicts in your life, either within the conflicts within yourself, shall I do this or that, and the conflicts between you and other people. So therapists have to be experts at conflict resolution. Unfortunately, that's not an expertise that most therapists have, or at least not consciously. Some people intuitively are good at mediating or helping people resolve their conflicts. They should also understand what the process is. So I would have them learn to be good at conflict resolution.
Yeah.
But I think the biggest thing, though, would be to take couples therapy seriously. And anytime they're working with someone who's married in particular, they need to work also with the couple. Oh, here's another thing I changed. I got a whole list here. There's a belief that if I'm your individual therapist, I can't also be your couple's therapist. Wrong idea. I must be your couple's therapist and your individual therapist and your spouse's individual therapist. They all work together.
So you kind of get the whole picture.
Exactly. Otherwise, it's like having a wife and a mistress. Neither gets the full package.
So do you ever have a situation where you're seeing one person but their spouse isn't willing to come in, and what do you do in those situations?
That happens from time to time.
Mm-hmm.
What I really don't like is if I was seeing someone and their spouse had a different therapist. So the way I get around that is when somebody calls for therapy, my secretary says, are you single or partnered, particularly married? And if they're married, she just says, oh, Dr. Heitler's standard routine is for the first session at least, come on in together. Yeah. So then right away, they both know they both have access to me, whether it's for individual sessions or couple sessions. What was the question you asked, though? Because it was a good one. What if the spouse won't come in?
Yes, yeah.
Okay, so we work with what we have. So I would work with that individual. I have a very interesting case now where I worked with a man who was troubled by some things going on in his relationship. His wife would not come in. We worked for a couple months and tried this and that, and the situation got somewhat better. About a year later, she was ready to come in. They came in as a couple.
Oh, wow.
Turns out I had totally missed what was going on. The things I had suggested had helped around the periphery. What I had totally missed was his part in what was going on. Once I saw them interacting together, it was not just what he was concerned about, which was what he could see she was doing wrong. It was also a whole set of mistakes on his part.
Right. Yeah, because you're only going to get the side that they want to tell you about, right? But if you're seeing both of them, then you can kind of get the whole.
And we only know what we know, and we know what we can see. Our eyes are pointed out, so he could see what she was doing. He didn't have the insight about what he was contributing. He was a lovely person. He just didn't know what he didn't know, so he couldn't tell me. Once I had the two of them in the room, she was able to verbalize what concerned her, and also I could see it happening right in the room, so we could fix it right in there.
Yeah, absolutely.
Yeah.
Okay, well, if there are no other questions from the community, I would just like to, again, thank you for being here, Dr. Heitler. I greatly appreciate it. Do you have anything that we maybe didn't cover that you wanted to talk about, or anything that you have coming up, another book you're writing, or other organizations, or anything you want to talk about?
Well, the one thing I might add is I've been focusing recently on something called parental alienation. That's something that usually shows up after a divorce, where one parent speaks negatively about the other parent, sometimes with false accusations, sometimes just with a critical word here or there and innuendos. They do that in order to turn the child against the other and bring the child just closer to themselves. Very bad situation. So I've been writing a lot about that. On Psychology Today.
My
blog there.
I'll be really interested to go and look some of those up. I haven't seen those yet. I'm actually just writing it down for myself to go and look up later, because we had my husband is divorced, and two of our kids are his from a previous marriage, and a lot of that was going on at the beginning, kind of whenever he and I got together. Lots of comments, not only about him but about me. I said to the kids that we had to then be like, do you really think this is true? Like, kind of what's going on. Excellent. And why don't you talk to us about this? And anytime you have questions, Excellent. Just make sure that you're talking to us. And it's hard to overcome as the other parent. Like, that is so hard to overcome.
Absolutely. And often if there is parental alienation after a divorce, it gets much worse when there's a new partner, because the old partner is jealous or resentful, wants revenge. And I will say, it sounds like you did a great job handling it. You hit a bump and you looked directly at the bump and figured out a solution, find solutions, which was to communicate with the kids, really talk about what's going on. Hey, where'd you get that idea that I'm a this and I'm a that? Tell me, when you look at me and when we interact, am I really a this and a that?
Yep.
Bravo to you.
Well, thank you. It was It was difficult, but I mean, that was a very long time ago. So, but having experienced that on the other side of it, it was miserable. It was absolutely miserable.
And were the kids able to get over it?
Oh yeah, yeah, absolutely. And
you caught it.
Yeah, it still goes on to an extent, but it's very much like one of them is 17 and one of them is 12, and they're very much like, I just don't even listen to it anymore. So they're able to recognize it themselves now, which is great.
That is impressive.
Yeah.
Well, there was a study of frequency of parental alienation a while ago, and then recently another was completed. The percentage of post-divorce couples where there is alienation is something over a third of couples.
Wow.
So it's very common. I just 3 days ago, I posted on Psychology Today an article called Parental Alienation, What Therapists Need to Know. Because unfortunately, many therapists are not well-versed in that field, even though it comes up inevitably in a lot of cases they see. In any case, when that blog post went up, it struck such a chord that within 6 or 8 hours, that was the single most popular, most read article on the site. Yeah, at least of the newer articles that are coming out.
Yeah, that's great.
So, and it was number one for several days. I was astounded at how much response there was.
Yeah, I just posted a link to it in the chat too, so I'll be sure that gets listed. I'm going to read through it as well because I'm interested. I'm interested in seeing. I have not seen it yet, so. Well, thank you again, Dr. Heitler. I appreciate your time today, and I know that we had some kind of technical difficulties at the beginning, so I'm glad we were able to power through. And this was a great time.
Thank you. It's been absolutely a pleasure for me, and bravo on all the people you're helping by doing these interviews.
Well, thank you very much. Guys,